up, everybody? Another episode of the Ripple Effect Podcast. Today we got a really important show. I think we're going to hit on some important topic. Real quick, just remember to subscribe to us on iTunes, YouTube, all the places you can find us on Twitter. Share your comments, suggestions, all that stuff. And today we got a full house. We got my co-host usually here, Dave Kornacki. We got my buddy Bob, who is expert in health and wellness and stuff like that. And then we got Dr. BURZYNSKI, who most people have seen. He has two really popular documentaries. He's been on actually there's a BBC documentary about his story. He's been on Oprah. He's been on Dr. Oz. He's been doing research on cancer research for over 40 years, and he's here to talk about his story. I think that his story is an important one. He's been, fighting with the FDA for a really long time, and he has a lot of critics and stuff like that. And so we're gonna ask some questions and let people make their own decisions and stuff. So I just want to thank Dr. BURZYNSKI for being with us today.
Thank you. It's my pleasure.
So let's start right from the beginning of the story. So you found anti-neoplastones, and how did you come about that? How did you realize that was that there were some benefits with that and to cancer and that there were some benefits, and how did you just basically stumble upon it?
Well, you see, I was involved in academic research since I was a student, so I just embarked on standard research and development of new medication. I had proper training because obviously I received my PhD at a very young age of 24, and I knew really how to deal with this. I discovered substances in human blood which were missing in the blood of cancer patients, and I felt that this is significant, and I began studying them to find out what do they do. Very soon I found, in cooperation with the other researchers from MD Anderson Cancer Center, that these chemicals have profound activity against cancer and they don't destroy normal body cells, which was amazing. And then, of course, we decided to move forward and develop these chemicals as medications. Then we moved through various steps of development, which are required by the government, which means animal experimentations, phase 1 clinical trials, phase 2 clinical trials, and finally, we are now permitted for phase 3 clinical trial, which is the final step of the approval process of medications.
But
so it's nothing unusual about it. That's a normal step of development. We move from one phase to another. If the initial phase gives us good results, we move to the next one. We found amazing results in laboratory tests, then we moved to animal tests, which were very good. Then we moved through phase 1 clinical trials, which proved that we can use medication without killing people, and the medication was not really giving bad adverse reactions. And then finally, we moved through a number of phase 2 clinical trials, which proved effectiveness, which means based on phase 2 clinical trial protocols. And finally, we are permitted by FDA to go through the final step, which is phase 3 clinical trial. Of course, we concentrated on the project, which is very ambitious and challenging, because we wanted to prove that we can get rid of the most difficult type of cancer, which, for instance, is brain tumor. And we did clinical trials in numerous types of brain tumors, and we proved that statistically we can get rid of brain tumors in good number of patients, and they can live happy ever after for over 5 years, 10 years, 15 years, or even over 20 or 25 years. So that's what we are able to prove so far. Of course, we don't have yet final admission from FDA that this treatment is safe or effective, because this comes with the final approval, which we don't have yet. And once such final approval is permitted, then every doctor in the country will be able to prescribe these medications. We are not at this level yet, but we would like to accomplish this.
Well,
and for brain tumors, this was accomplished based on the results from phase 2 or phase 1 clinical trials, and that's what we are at this moment.
Yeah, and I think the interesting part of your story is how much the FDA has harassed you. I mean, you've been rated, and I know you've lost tons of research through this being rated. You took like 12 years to get some of the research that you had. I know that you've been brought to court numerous of times. I think it's weird because I think in many cases we understand that money. Greed can get in the way of treatments and what's best for people. And you look at like prescription drugs. Obviously, we have a huge prescription pill problem with painkillers. We have a kind of an overprescribed society. Everybody knows the story of like the DSM and the psychiatric antidepressants and how just how big pharma and FDA have kind of been in bed together in some cases. And the thing is that it seems like, but for some reason, it's like if we talk about corruption and greed and stuff like that, everybody kind of agrees that it exists. But it's amazing that when we talk about your story, all of a sudden it's like, oh no, why would the FDA not approve of this? Why would the FDA, if it's safe and whatnot? And the thing is that always seems pretty.
Well, it's very strange, of course. Well, I'm sorry. We have probably. Are we still online? Okay.
Yeah.
All right. Great. Okay. Well, this is weird. We have now 30 years anniversary of harassment by FDA and by state agency, which is Texas Medical Board. Recently, they conspired together to put us out of business. And I don't know how the people would like to call it. Both FDA and Texas Medical Board, they have tremendous amount of evidence that this treatment saved the lives of numerous people. The people who don't have any other treatment available. Basically, every year, statistically, we can probably save 20,000 lives of brain tumor patients if this treatment is permitted to the doctors in the United States. 20,000 lives is like a good-sized town.
Absolutely.
Which dies every year, okay? And the numbers are increasing. Probably in another, say, 10 years, the number of deaths would double. And there is nothing at this moment which can help these people. None of chemotherapy works for brain tumors. All of this was discredited. Radiation therapy works only for a short time. Everybody dies from brain tumors, except for some exceptions when brain tumors can be detected as very little change and removed successfully through surgery. And this covers important politicians like Senator Edward Kennedy, who died from brain tumor, like the director of the National Institute of Health, Bernardine Healy. Everybody dies from it, okay? And we can save a lot of these people. We proved this to the FDA, we proved this to Texas Medical Board, yet they would like to get rid of us, okay? I don't know how do you call it. I would call this criminal, okay? And this should be exposed to the people, and the people who are involved in such activity, they should be treated like mafia bosses who are really conspiring against American people. That's what they are, okay? And they should be exposed. They should never be in this position. And why they do it? They do it for money, okay? And this is very well exposed in the movie of Eric Merola, okay? He found that the people from FDA, people from National Cancer Institute, people from pharmaceutical company, they got together and they decided to put us out of business and to steal my discovery. That's what was proven. There's no doubt about it. If such activity continues today, if still there are some other people who like to steal what we have and make billions of dollars on this, I don't have yet proof. But why these people from FDA, why these people from Texas Medical Board are so vicious against us, okay? I was called in front of Medical Board 35 times, okay? It's an unholy inquisition, okay? And they're completely unpunishable. They can do their dirty job all the time without any punishment. And nobody can do anything for them, okay? And that's like a kangaroo court. You go to the, from the very beginning, regardless what you do, they will get you, okay? So I think finally American people should wake up because that's what is going on. It's like in Nazi Germany, and it's not good for the country because people will have less and less freedom. People are deprived from the treatment which could help them. And this should stop, and this should stop now. And a program like yours, it's playing a very important part. Because pretty soon, when marijuana is legalized, nobody will be pellet damn what is going on, because everybody will be happy in marijuana vapors, okay? And this will be too late, okay? So the time is right now to wake up and ask paramedic people to take what belongs to them. People would like to have access to treatment with saving life, and they should not be prevented from it. They should have such access available if this treatment gives them at least some chance that they can live. And that's where we are. It's nothing unusual about it. This is fundamental right of the people, and the people should fight for it.
Yeah, I think you made two really good points. I think that anybody who thinks that they wouldn't legalize or approve something that is helpful to people could just look at the marijuana story. Marijuana has been, I mean, Dr. Sanjay Gupta had that documentary on CNN, Weed, which he came out and said, hey, I've been deceived. They've been trying to tell us that this is bad for us or this isn't healthy when there's tons of medical benefits of it. And my point is that that's a perfect example of people saying, hey, this isn't good for you, this shouldn't be legal or whatnot, and really there's no evidence that it's harmful to people. And if it can help people, let's be honest, there's tons of pharmaceutical drugs that have a lot of side effects, are harmful to people, and are legal. So your treatment, from my understanding, seems like, yeah, it doesn't save everybody, but the bottom line is that it does help a good portion of people, and the side effects are minimum to any. So why can't that be an option? And that's, I think, the whole thing that really bothers me, because it seems like a lot of skeptics and you get a lot of criticism. And I'll tell you, my hat goes off to you, because just anytime I share your documentary on the web, or anytime or just mentioning you're going to be on the show, it seems like people just jump on that and start, and just really are there's people quick to kind of say that it doesn't work and there's no reason why the FDA wouldn't approve of it and this and that. And I'm just, if I'm getting that, I could just imagine what you get daily. But that shows that obviously if you wanted to, you could say, you know what, forget all this. It's too much hassle. What's the point? But obviously you've gone raided, you've gone to court. I'm sure you've spent a lot of money fighting the FDA. And I think your heart's in the right place. I think you're trying to help people. And I think that hasn't the FDA actually said that they never said that your treatment was unsafe, right? They've never said that it was toxic. It was just, they brought you to court without really having a real, I mean, it got dismissed a bunch of times, right? Like they never really had it. They never said it was unsafe, right? Your treatment, the anti-neoplastones.
Absolutely, it was not said that it was unsafe. To the contrary, the treatment is associated with some side effects in some people. But you have to realize that you are dealing with extremely sick people. These people typically carry death sentence from their disease. They are very sick, okay? They can die at any time. And suddenly, we can't help everybody. Some of them are dying, okay? And they die from the disease. And it's easily to say, well, they could die because of the treatment. No, they die from the disease because they are very sick, okay? And they come to us in terrible shape, okay? So if you use the treatment right, the treatment is very well tolerated. If you don't use this right, you may have some problem. And obviously, there are some errors which were committed by patients themselves where they missed the medications and then some side effects occur. But normally, if the treatment is used right, it's very easy treatment and it can be used without really any significant side effects. So that's where we are. We have many people who can stand up and say, we are the survivors over 5 years, we are survivors at 10 years, we are survivors at 20 years. And this is first time in medical history. Nobody was able to have such people with this type of diagnosis. And our critics who are hired by and well paid by Big Pharma or by some other medical institutions are saying, well, all of these people were misdiagnosed or cancer disappeared on its own. What they're talking about, these stupid fools. You can misdiagnose hundreds of people when these people are coming to us from the best institutions in the world. These are graduates from Mayo Clinic, from Sloan Kettering, from MD Anderson. They were seen by the best specialists in the world and they were given up, okay? So how they could be misdiagnosed? They were diagnosed perfectly, okay? They came to us and it was proven that their tumors were gone and they are living normal, happy life many years after that, okay? It's no joke about it. These people are living normal life. they can have their children, or even have people who recover from deadly brain tumor and have grandchildren, okay? So this is what happened, and nobody was able to prove this so far, and we are. Of course, from what I know now, it's most likely that I be sued by Texas Medical Board, because they're saying that what I am saying, the truth which I am saying now, it constitutes false advertisement. So there is certain risk what I'm telling now, because there is no more freedom of speech in the United States. So I may be taken to court for what I'm telling now. But I think it's very important for American people to realize what it is, because the freedom is taken away from them, okay? So they need to know what is going on, because this is the lifesaver for them.
Well, I wouldn't. It's funny that people do say that. They say it's false advertising, but you never say you can cure everybody. What you're saying is that you have this is the percentage of success rate, and it's an option that's not harmful. And like the story in your second documentary, Laura and Ben from England, from the UK, perfect example. They went to you as a last resort, and so her doctor in the UK said that she had no hope, that she had no chance of surviving. And actually, it was kind of a messed up situation, because she had to go through chemo first before she could see you, right? I believe. And then because the doctor said that the only way they would pay for it or something like that she had to go through, it had to be a last resort because it wasn't FDA approved. So, and then she went to you, and she's alive, and she survived. And the thing is, your second documentary, you even tell the story, or Eric tells your story of even people who didn't survive, because a lot of people would say, oh, well, he only focuses on people who survive. And it's just like, no, well, there's people who don't survive, but there's people who don't survive on chemo. There's people who don't survive on radiation. I mean, that happens in all treatments. So the fact that they're harsher on you when somebody doesn't survive than other stuff, I mean, it to me seems pretty insane. It definitely seems like, and a lot of the hearings and stuff that were happening in the movie, it seemed like even judges, even congressmen, they all could tell that they seem like there's a personal vendetta out to get you. And I think that's, if anybody hasn't watched these documentaries, the first one is online for free. You can just look up Burzynski. There's also a website called BURZYNSKI The Movie .com, and you can go on there and watch the movie. I think regardless what you believe, watch this movie, and to see people that have been saved, to see people that literally the doctors told them they had months to live and are still alive today. The fact that something that can help people is being harassed and it isn't being FDA approved. I know you got the phase 3 of approval, and then you had a problem with phase 3, right? Didn't hospitals didn't want to work with you?
The problem is such that it costs a lot of money, and we don't have this money to move forward. It can be done, but we don't have money to go for it. Then obviously most of the hospitals in the United States don't want to get involved, because obviously they don't want to deal with FDA under such circumstances. But it can be done, but simply we don't have money to do it. And it's not necessary for brain tumors, because every medication for brain tumor in the United States was approved without phase 3 clinical trials. So our treatment shows ample evidence that people can get rid of brain tumors and can live for many years. And it should be approved without phase 3 trials, and phase 3 trials can be done later. So that's what we are asking FDA to consider now, and that's what should be permitted.
Yeah. Well, before I talk the whole show, you guys want to jump in and
You know what I wanted to ask, with relative to what you are researching, when you talk about the drugs that you're using, could there be something done to prevent the onset of cancer using these same medications, instead of using the medications that you find? The way I understand it, it's like a switch in the body shuts down the process of making these proteins. Is there a way prior to getting cancer that you can supplement your body with these to prevent cancer? Is that something that's being looked into?
There is a way. We did animal experimentation, and also such experiments were done by some other teams, like, for instance, the team in Japanese medical schools. So there is a proof that we can prevent very important cancers, for instance, like liver cancer, by adding to the diet some ingredients which we discovered. But this was not yet validated by clinical trials. These are large clinical trials which typically involve thousands of people, and we did not attempt to do such clinical trials. This can be done, of course, in the near future when the funding is available.
Do you feel as though the red tape and all these obstacles that have been in your way has slowed down other research as it relates to the things that you're looking into? Do you feel that that's distracted you from being able to further some of your research?
I believe it is driven by the market. Currently, the market for brain tumors is something like $20 billion a year in the United States. The medications which are used, they can help only for a short period of time. And obviously, pharmaceutical companies don't want to give up on them. Okay, they still would like to make these billions of dollars for some time. If we are right, our treatments introduced, the other treatments will go away. There will be switch in the market for brain tumors. And I believe that's why these agencies are trying to get rid of us, because they're protecting big market, okay? That's pretty much what it is. They don't work for American people. And this should be investigated. I believe the Texas Medical Board is as corrupt agency as it could be. It was proven already, and they would like to put us out of business. They harass our doctors, and I believe they work for big medical institutions, which are really envy from what we can accomplish, and which would like to get rid of us. And this needs to be investigated. But how can you investigate such corrupt organization like Texas Medical Board? They're pretty much immune to everything, okay? They're state agency, they have immunity. Federal agencies, federal government cannot touch them, so they feel that they're immune from everything. And they can do their shady job all the time, okay?
And I think a perfect example of corruption, I mean, look, I don't know if you guys heard this story in India recently, but Bayer has a liver cancer pharmaceutical drug that apparently it's like $5,600 a month for, and some generic Indian company made the same drug that costs $175 a month. So obviously it's huge difference in cost. And Bayer, what do? They're fighting it to try to not let it get approved and get on the market. And then when they ask why are you doing this, they're like, oh, our drug wasn't for India. It was for the it was made for the West, and that's why it's so expensive. But that type of stuff happens all the time. And so I mean, there's tons of stories like this that show that corruption isn't. I mean, in pharmaceutical world and drugs, and there's a lot of money in not a cure but treating somebody, and that's where the money is. Not giving somebody something that it's about giving them a pill that they can take for the rest of their lives, and or at least for a long period of time, and make money off it. Bob, you want to jump in there?
I did have a question about if
you might have to talk louder.
Oh, sorry. I just had a question about if I had a loved one that was interested in contacting you, how hard is it to get on a clinical trial?
Did you hear him?
Currently we are done with clinical trials, and we are just putting together the data. FDA would like us to open another clinical trial on which we are working now. And it's not easy because obviously there are very strict entrance criteria. The patient needs to be evaluated first. They should be approved that there is progression of cancer. Only some patients can be admitted. It's not easy task, okay? So clinical trials are only for a small group of selected patients because they are very difficult entrance criteria. And these entrance criteria are not dictated by us. They are dictated by very strict regimens imposed by FDA, okay? It's not only regarding our clinical trials. Every clinical trials have very strict entrance criteria, and it's not so easy to get into clinical trials. But we are working now on the new clinical trial protocol, and that's what we would like to do.
And so if somebody wants to get your or wants to look into your treatment, what's the steps to do so? Is there certain things that maybe the insurance won't cover, will cover, certain processes they have to go through before they can go to the BURZYNSKI clinic in Houston and give it a try, or at least look into it? How does that work? If somebody...
Well, currently, we are not using any medication which is in clinical trials because we are done with clinical trials. So at this moment, nobody can get in the United States medications which we use in clinical trials. Unless FDA will give them special permission. A number of patients are trying to get such permission. They're asking their congressmen, senators to force FDA to give them access to medication which we have. And they may be successful, but at this moment, such possibility do not exist. People are coming to us and they are receiving treatment with medications which work on the genes, which is called targeted therapy, and also with one medication from the group of antineoplastons, which has been approved by the FDA. So that's what we can do now. And we can treat a lot of patients successfully this way, but the treatment probably does not have as good a durable effect as intravenous antineoplastons. We are studying this now. These are the new medications. We don't have yet 10 years follow-up, but for instance, we have some patients who are now surviving over 7 years and are free from cancer, which is not bad, okay? So there is a hope that we can help some patients now by using one medication from group of antineoplastons, which is prescription medication, plus medication which works on the genes. And that's what we do on a daily basis in our clinic. And such treatment can be covered by the insurance. It depends really on the insurance policy. So this is what is evaluated by our staff, and we are very glad to help patients in this area.
And you're working also on, I guess for a lack of a better term, the personal cocktail. Like you can kind of, because I've heard you say numerous of times how complex cancer is. It's not just one disease or 100 disease or whatever, and I know that you've been working on like this personal, using different type of drugs to focus on each specific person and their specific issue. And how would you get something like that approved? Because obviously every single person would have to have their own type of, I guess, cocktail, for a lack of a better term.
You're right. There are thousands of different varieties of cancer, and each of them has different combination of genes. The solution is to run a genomic study, and that's what we typically advise. This is usually covered by the insurance, and once we have these results, we select the medications which works on the genes which are involved in the individual patient. And it can work amazingly well. For instance, at this time, when we are treating brain tumors, we are using combination of medications which work on the genes, typically no chemotherapy, no radiation, and in many of these patients, we see highly malignant brain tumors like glioblastoma disappearing from the scans within 2 months. We don't know yet what is going to happen to these patients 10 years from now, because the time is too short. But at least we have some patients with brain tumors, as I mentioned, who are now over 7 years and continue to be free from tumor. So it's possible to have also long-term results in such cases, but not for everybody. It depends on combination of the genes individual patient has. So that's what we do now, and the results could be really amazing if we have the right patient and the right medications.
Yeah, and I definitely, every time I hear your story, the one thing that seems to be non-existent is the talk about it being harmful. We talk about chemo, and everybody knows that's harmful, radiation's harmful, and with such little evidence that your treatments and and your research isn't benefiting and is harmful, to me I guess it probably makes me just as upset as it makes you that that people don't have at least the option. And that's the thing that bothers me, is that people should at least have the option, and the fact that people are taking away the option from looking into your treatment and looking and actually they're preventing you from further research, because obviously they're bankrupting you by making you spend all this money going to court, rating you, all this stuff, and making you go through hula hoops. I think that that people should, like you said, people should get upset. People should look at that and say, hey, regardless if you think that it works or doesn't work, the fact that it's never been proven to be unsafe, and the fact that the FDA has said himself that it's non-toxic and it's not harmful, then why isn't this option on the table? Why can't it be, when we do have things that are harmful that are on the table, like chemo and radiation? And so I just think that that alone should open people's eyes and let them kind of notice that, hey, you know what? Why are people calling this guy a fraud? I know even Wikipedia, even doesn't like you, apparently, because Wikipedia, has all this information that seems a little, their opinion pops out a little bit. It's amazing how many skeptics and how many people are just, I guess, calling you a fraud, and it just, to me, it's like, well, show me the evidence. You say the words, but tell me that there's not drugs on the market or treatments on the market that there aren't side effects. there's a lot of drugs that there's a lot of side effects, and most of the time, like that the story of that officer in your first movie, Sergeant, I can't remember his name, but who had the twin daughters, and she went to your treatment. For people who haven't heard this story or seen the movie, basically there's this officer who had twin girls. She basically had cancer. Doctor told her the only thing they could do was prolong her death by giving her chemo and radiation, and then basically changing her diaper was so toxic that they had to wear gloves. And then eventually, a year later, she ends up passing away. They end up doing an autopsy, and she's completely cancer-free. It wasn't the cancer that killed her; it was the radiation that killed her. And there's stories like that. There's tons of stories like that. And the fact that your treatment isn't on the table and isn't an option, I think is insane to me. It's insane, and I think that if you just say, hey, this doctor has a treatment in Texas that basically is an alternative and this and that and can help cancer patients, people just think, oh, that's crazy, but look, do your research. Don't just read it don't just Google it and just read one post. Do your research, come up with your own opinion, look at the facts, and definitely watch the movies. Bob, you want to jump in here?
I just had a question on the person that's listening out there. How can we help if we believe in your cause and that you're helping people? How do we get the message out there? Do we contact our senator, our congressperson? Is there a place that we can donate?
Well, certainly patients are organizing, and they have their organization which is trying to ease up the access to treatments which are still investigational, but which can save lives. Our treatment is one of them, but there are some other treatments. So basically, in the other countries, the access to such treatment is extremely easy. For instance, in Australia, the doctor simply placed a phone call to the agency, which is equivalent to the FDA, and they permit him to treat patients the next day. So there's no problem with this. In Japan, the same thing. In the UK, the same thing. But the United States, some of our patients have to wait 6 months to have permission to get treatment, and many of them are dying during the process because the bureaucracy which was built up by FDA is so horrible that the patients are dying while they're waiting, okay? So that's what should change, and it should change right away, and people should demand that those who are diagnosed with catastrophic disease, who are told by the doctor there's nothing else we can do, they should have easy access to investigational treatment, and this should be available for them. We are offering treatment to such people free of charge. We are giving them free medications, and yet the government is creating a lot of obstacles. People should wake up, and they should demand that it should be given to them right away. And this is what is now on the table for the organization of our patients. Also, federal government should not interfere in medical decision. The people who have FDA, they know very little about treatment of brain tumor. This is a highly specialized area. Yet, the people who don't have even medical education, they decide if the patient would live or die, and they interfere with medical decision. They conspire with local medical board to put doctors out of business. This should be investigated, and those who are involved in such criminal activities should never be in public offices.
Yeah.
So that's something which should be demanded, and American people should give support to these brave patients who are fighting for their lives, because obviously they are one of us. The statistics are horrible. The United Nations just published the statistics which indicate that just in 10 years, there will be 50% more cancer cases, and millions of people will be dying all over the world. So the war on cancer pitifully failed, okay? There's more cancer being diagnosed, and more patients are dying. There's time to wake up, and this is up to American people to wake up and demand what is their own.
Yeah, I heard that. Oh, sorry. Real quick, I just want to confirm that. Yeah, I heard that recently, too, that the World Health Organization just predicted recently that in the next 20 years, cancer rates are going to rise 57%. And so I just wanted to let people know that statistic is out there. That's not a opinion. That's a prediction from the World Health Organization. So what were you going to say, Dave?
You know what? You mentioned statistics. Is there a way that you can simplify? I know this it would be a difficult thing to do, but to quantify the success that you've had with your treatments in your clinic? Is there a way that you could say this percentage of patients have survived this period of time? I mean, I think that when I look at the critics that are out there, they're always looking for some statistics or numbers to substantiate your treatment. And I understand that a lot of the cases that you get at the clinic are things that have been given up on by what is perceived to be conventional medicine. So I know that kind of puts you behind the 8 ball to start, but is there a way that you can quantify the success that you've had at the clinic? I think that's what critics are kind of looking for. If there's a way that you can say we've treated X number of patients at this, with this type of cancer, and we've had a success rate with this amount. I know that in some cases you've been, not allowed to say that because of FDA regulations and trials and things like that. But what can you say today that would explain the success that you've been able to achieve down there?
Well, I am limited to information which I already presented at some medical meetings, okay? Because the other information I cannot share with you because this is something which FDA would say that this is advertisement. But we presented a number of our data at medical congresses, and even I included some of this data in continuous medication course accredited by American Medical Association. So this data I can share with you. And probably the cleanest data are coming from phase 2 clinical trials in brain tumors. We have approximately 20% of patients diagnosed with incurable brain tumors who are surviving over 5 years. And what is the survival with standard treatment? Recently presented data at the largest Congress of Neuro-Oncology in San Francisco indicated that the median survival for glioblastoma, which is the most common type of brain tumor, is about 12 months, okay? That's the median survival for glioblastoma today, which is not bad because many years ago, these people were surviving only 4 months. But now they're surviving median survival is about 12 months. We have in our clinical trials about 20% survival at 5 years. And obviously we have a number of survivors at 10 years or even 15 years. And many of these results have been already published. Well, how this translates to the numbers? In our clinical trial programs, we have about 400 patients who are eligible for such analysis, and 77 patients from this group in clinical trials survived over 5 years. In the entire program of clinical trials, and this included also patients who were under compassionate exception, we have 120 patients who survived over 5 years with brain tumors. This is a pretty good number. And obviously, if somebody is alive, you cannot cheat it, okay? Somebody's alive. Yeah, it is very easy to identify. And obviously, majority of these patients have their tumors gone, okay? And some of them could be questioned. There is still a trace of the tumor, but they're alive and living normal lives. So that's what it is, okay? So that's the data which we have. We are very strong regarding survival data. And obviously, we have also data regarding disappearance of the tumor, whatever. But this is overall idea. Well, if you look into some classes of brain tumors, for instance, brainstem glioma is a pretty bad tumor. And in brainstem glioma, we have about over 60% of patients who are surviving over 5 years, okay? In childhood astrocytoma, which is very bad tumor and very common in children, the most common tumor in children, we also are over 60% if you are talking about over 5 year survival. So basically, in various categories, we have different statistics, and these are the details which can be explained. Some of them already published, presented, and the others are in the process of presentation and publication.
Yeah, that pretty much answers it. I mean, that seems to be the big criticism, that is people are saying those statistics are not out there. So where would we find those things published? Are those accessible? Is that something that we could link to our talk here today, or?
Well, the statistics regarding response rate are published every year and they're updated in the reports to SEC. The company which sponsors clinical trials is BURZYNSKI Research Institute, Inc. And in annual report, the results are reported every year for each classes of malignancy. So it can be easily find. It could be found on the internet. Our office can provide internet address, and this is current information. On the other hand, every year we go to some of the most important medical congresses, and we are presenting the results, which are current results. In November, we had 4 presentations at the World Congress of Neuro-Oncology. This week, we are submitting 3 presentations for another congress. So basically, within now and June, we are going to have 4 presentations at important congresses, including Neuro-Oncology Congress in Stockholm. So we are doing this all the time. And obviously, we have publications which already were printed, and some others are under peer review. It's an ongoing process. And if somebody would like to have some additional information, we'd be glad to present it to them. There's no secrecy about it.
Awesome. Anybody have any final questions?
I just wanted to find out how many researchers you have on staff and/or doctors.
Well, we have about 20 medical doctors and PhD, if you are talking about senior researchers, and we have a number of technical personnel and people who have college education, etc.
Awesome. You got any final thoughts?
I guess my last question would be, you've fought this battle down in Texas for so long. Have you ever considered relocating? You mentioned Australia and Japan, where the process seems to be so much easier. Have you ever considered relocating to another country or another location to, where you would be allowed to do what it is that you do without being bothered with these other, extemporaneous aspects of this work?
Well, we would like to stay in the United States as long as we can. Of course, if it become impossible to function in the United States, we move to another place. But at the same time, we are invited to set up treatment facilities in various other countries. It doesn't mean that this treatment will be approved in the United States first. That's what we would like to do. But it could be approved in the other countries in the first place, and at least people would have a chance to go to the other places and have the treatment. We are working on this, so this is really a global approach to this treatment. So it's not just the United States. We have numerous offers from various countries to do it, and this is in the process now.
Well, actually, you bring up an interesting subject, because actually you had a couple other international companies that were interested, right? And then they got scared because of the FDA obviously harassing you. You had like a Japanese company, I believe, or Australian or something, right? Wasn't there some?
Absolutely. Well, at this moment, patients in various countries can receive the treatment, and there's a clinic in Tokyo which where the oncologists were trained how to use our treatment. So certainly it can be done. Clinical trials were conducted in Japan. And in many other countries, we are in the process of setting up the clinics, which obviously will have the right to use the treatment with full support of the government. So that's something which is awkward. It's like before World War II, scientists need to immigrate from Nazi Germany, and they didn't help Nazis. They were defeated, okay? So now scientists will be escaping from the United States because there's very little freedom in medicine, okay? Yeah. You can't really use any innovation because you'll be punished, okay? So everything becomes so corrupted that really practice medicine in the United States is becoming almost impossible if you would like really to do whatever you know is the best to help patients. But I think American people can change it, and I think they better do it, because otherwise the country will go downhill, okay?
Yeah.
If you restrict scientists, if you punish innovations, the country is not going to be successful. It will be defeated.
Well, we already have an issue with just over-prescriptions. I mean, we have a huge, I think we're 5% of the world's population, 50% of the world's prescription drugs are used in America, which is a ridiculous amount. And so I think we definitely have some issues with some monopolies in drugs, and we obviously have we have to get the FDA to stop harassing Dr. Brzezinski so he can get his treatment out there and help people. I mean, I want to thank you for being with us. I think it was.
Thank you very much. It's my great pleasure, and I hope we can help many people. If somebody has more questions, please get in touch with us, and we'll be glad to give you more information.
Yeah, it was an honor. I remember the first time I watched your first documentary, it blew my mind. But it wasn't surprising to me because on this podcast and just in my personal life, we talk a lot about corruption and kind of the evils in the world and how money pollutes a lot of good things. And so I wasn't surprised, but it was amazing that obviously you're in Houston, Texas, and there's this guy with this groundbreaking treatment that isn't being let treat people. So I just want to thank you. I know Bob's a fan of yours, and Dave, we're all just fans of what you're doing. We think that it's awesome that you're using this fight to kind of get awareness out there, and you know what, if we can do our part of just exposing your information and your treatment and just your clinic in general and your story to a handful of people, then I feel like we're doing our part and we can help a little bit. So I just want to thank you so much for being with us. You guys have closing thoughts?
Thank you.
We're good. Hey, I know you're trying to save people, so we got to let you go because you got some work to do. You got more important things to do than we do. So
very important part in this. Thank you very much.
Hey, thank you, Dr. Brzezinski. Have a bye. What is up, everybody? Another, actually part 2 of this episode. We just had Dr. Brzezinski on, and you're going to hear that part. And now we have Eric Merola, who is the filmmaker who did the Dr. Brzezinski movie, both of them, who actually exposed me to his story. And I'm guessing the story probably motivated me to look into it and kind of hit a soft spot the same way that the story hit him and motivated him to do the movie. So I just want to thank Eric for being with us. The other voice you're going to hear is, like usual, my co-host Dave.
How you doing, Eric?
Very well.
And just wanted to basically, you documentaries wasn't your first line of work. You end up, my understanding was, I think I heard in an interview that you heard the Dr. Brzezinski story or you read it in a book, and then that's what kind of motivated you. It kind of kept lingering in your head, and then you're like, you know what, I have to tell this story, and you kind of felt like, doing the documentary was doing your part.
Sure. Basically, I was working in New York, doing like motion graphics and doing animation and doing things for commercial clients. And working in TV and film has sort of always been my end goal. And I've always loved documentaries. So yeah, you basically summed it up. I read a book that was published years ago, back in the early 1980s, called The Cancer Industry by a guy named Ralph Moss. And I won't give you the long story about this guy, but he basically was fired from Sloan Kettering Cancer Center in the 70s because of he was a part of another cover-up of another, at least in their studies, was effective. Nothing like what Brzezinski has, but it was enough where it was effective enough, and the institution lied about it. And anyway, he was fired for trying to blow the whistle on this. But it just sort of opened up his whole world. It was going to be catharsis for him. And he wrote a book called The Cancer Industry. And in that book, he not only talked about his story, but he talked about other people that have had similar situations. And Brzezinski was one of them. And this is dating back to the early 1980s. So this is really before it really became well known, and he was still very early on in the process. And even back then, what he documented in the book was very crazy. The fact that this guy had gone through as much as he had even back then and still standing. Anyway, the short of it is, I just became pretty obsessed with it, thinking, wow, how come no one knows about this if it's effective? So I did two things. I wanted to sort of do my own investigation and meeting patients to see, how real this was, and of course meet him. And I just started cold calling and bugging him in the clinic until I sort of gained their trust. And it really wasn't until after I started interviewing patients and putting together like a little 30-minute piece on the patients and their medical records and things like that, and showed it to him and showed him that I really wanted to dive into this deeper. So I went into it not even knowing if he was going to agree to do it. So, and then finally he did, and sort of here we are. But yeah, it definitely has taken up a lot of my life, as you can imagine. Especially with part 2, following patients around technically, from beginning of treatment until seeing how they do. It's a big investment, to, you're also, even people that made it out okay and people that didn't, it's a very personal side of their lives, as you can imagine, and sometimes very traumatic and sometimes very exciting. And it's not easy to let people like that to let you in their lives and tell that story. So it was pretty intense.
Yeah, and I think the one thing that I think you did less in the first movie that you did more in the second one was you actually documented some people who didn't survive, and I think that some of the skeptics and criticism is that, hey, people don't survive and this and that, and I said this to Dr. Burzynski. It's kind of unfair that he's held to a standard that's higher than other drugs, because chemo and radiation doesn't always work and people don't survive. So, and there's plenty of drugs on the market that are unsafe, and there's plenty of drugs on the market that become FDA approved. I mean, Yaz is one of them. It was FDA approved, put on the market. So obviously the FDA at one point said it was safe and healthy to use, and then all of a sudden it was taken off the market. So, and I think you've said in an interview before too, and I completely agree with you, and that's kind of a case that I make, is that why do people think that there's corruption and greed in so many different markets, and in prescription drugs, painkillers, antidepressants, in the oil industry, and all these different things, but yet, people have a hard time believing that the FDA wouldn't make or would give a hard time to a cancer treatment, that would end up being, I guess, alternative to a lot of the mainstream stuff. So it's one of those things where it seems like a lot of the skeptics, they have a hard time believing that, but you look at other aspects of society and other aspects of markets, they all have a similar issue, and that's once something is profitable, you can influence the market, and you can make sure that competitors, or in cars, you can suppress technology, with the electric car or whatnot. So I mean, it's not immune to that type of corruption and greed, and I think that's the thing that people seem to not realize, or they would think. I think we try to look for the good in people, and we think that because it's cancer treatment, nobody would ever suppress a treatment that can help people. But unfortunately, that's kind of the case, isn't it?
Yeah. There's many levels of how I can respond to this. I'm going to start, I guess, with the easiest one. Like when you talk about skeptics, there's an organized group that label themselves as skeptics. And then, of course, there's the practice of just being a human being and being skeptical. The skeptics, so-called skeptics, they don't practice the act of skepticism at all. They hide behind that sort of bizarre double standard. And there's some of them that are assigned by the industry to do what they're doing. With the internet nowadays, and with information being unregulated on the internet and flowing freely, it leaves it wide open to all sorts of corruption. And in this case, you have people that disseminate all this false information online about him. Another thing that they do is that they find the biggest weakness and harp on that. They ignore everything else and as irrelevant, and they harp on the weaknesses. So that's their job to say, no, see, these people didn't make it, that person didn't make it, and as if someone is out there saying that this is some kind of miracle magic bullet. No one has ever said that, ever. And it's still an experimental drug. And but like going back to what you said I did between part 1 and part 2, even though in part 1 I clearly showed the FDA statistics that they recorded of the percentages, and they were low. For brainstem glioma, even though it's never been cured in medical history outside of an anti-neoplaston clinical trial, it still has a less than 30% 5-year survival. But somehow that went over everybody's heads. The general public, some of them said, they didn't absorb the fact that I put those statistics up. And then, of course, the skeptics will go out there and say, they're claiming it's a miracle cure and blah, blah, blah. Anyway, so I decided to address all of that by making this. The second movie was both to follow patients, but I wanted it to be more of a modern story. The first one showed sort of the history and all the mayhem he survived through. And the second one the initial goal was to follow patients. So yeah, exactly. And so it was very risky. All of them could have not made it. And then that would have been, that would have had to shown that. But 50% of them did and 50% of them did not. But all of them had universally deadly brain tumors that normally are never cured in history. But those aren't the only 4 patients in the film, obviously. There's a lot of other ones in there. But as far as ones that I actually followed, yes. And going back to the corruption thing, it's taken me a while to really sort of wrap my head around it as well. And I just come to the conclusion, this is just me personally, that, there's a lot of people out there that come up with all these crazy conspiracy theories and think there's depopulating the earth and they're out there they don't want a cure for cancer because there's too many people. There's all kinds of things that people come up with. But I think the market and how it behaves adequately explains what's going on. Because you're talking about a multi-billion-dollar industry. And I'm going to stop for a minute and say, we're all of us, since we were kids, it was almost like the cliche to say, if you find the cure for cancer, you're going to be a millionaire, or a billionaire. But in reality, as crazy as that might sound to most people, if they found a cure for cancer, especially one that cured all of it, what is going to happen to this industry? And it's something people don't think about, because let's just say, hypothetically, that the drug Avastin was a magic bullet and they made $6 billion a year off of that one drug. Let's pretend that it was a magic bullet and it cured all cancer. And even though it's cost $100,000 a year to have it, well, that drug is eventually going to run out of its patent and become generic, just like an antibiotic. And what is going to happen? What is the need to investigate cancer much further? What is going to be the need for all the radiation machines and all the chemotherapy that's out there when you have a magic bullet? So it's just something that people need to take in consideration. And you have this perpetual war on cancer, just like the war on terror or the war on drugs. And as soon as a war has been established like this, what it does is it by default builds an infrastructure that it depends on the war being sustained, not won. And that's another aspect of it all. So we've just sort of caught in this trap where there's just no incentive to find a cure for cancer. And so if someone like BURZYNSKI comes along with something that's at least non-toxic and at least has a better result than most cancers, especially in certain types of cancers that have just never been cured before, the market's going to do whatever it takes to knock that guy out. Like just recently, there's a guy, I can't remember his last name, but NPR had a thing on this guy named Tyrone. He was a biochemist and he was studying some chemicals related to a company and found that the company's chemicals were really toxic. And then he tried to get the word out about that, even though they hired him to do it. And they did everything they could online to marginalize him. They were buying Google AdWords. They're doing everything they can to destroy this guy's reputation to defend themselves. That's precisely what's happening right now with BURZYNSKI and has been going on for a long time. So, yeah. You'll notice that they'll always harp on the weaknesses and ignore all strengths. They pretend that he's never cured anybody. They write that, the people that have never met BURZYNSKI, never met the patients, never even seen their records go, well, I'm sure that girl, Tori Moreno, she wasn't really cured by BURZYNSKI. It happens all the time. But if people are naive enough to believe what they read on these blogs, what can you do about it? But they prey on those people that are naive enough to believe in the system wholeheartely. So.
Yeah, and actually our podcast, that's one thing that we talk a lot about, the war on drugs and the war on a lot of things, on terror and how, obviously the most profitable way of I guess using that war is to sustain it, and that's how you keep money going and people making money, and this isn't much different, and I think it's right. You're right about it. It's very healthy to be a skeptic. It's very healthy. But I think there's something about people that once they decide they're a skeptic, or once they decide because we've hit on probably some not conspiracy theories, but some things that end up some people consider conspiracy theory and end up having some truth to. And our whole point is be open-minded to everything. Don't be a skeptic, sure. And don't. Because what happens once somebody considers themselves a skeptic, then they basically their goal is basically to find a flaw in everything. And
they close themselves off to being open-minded once they commit to being skeptical, though.
Absolutely.
And that by definition is not skeptical. That's making up your mind in an opposite direction.
Yeah, absolutely. And the same thing with conspiracy theories. We try to let people know that, look for, be skeptical, but and question everything, challenge everything, but yet don't pick a side. Be open-minded, because you can't, if you go in looking for an outcome, you're going to find that outcome. And you're going to, like you said, people are going to ignore certain information that ends up making the other argument or makes the other point, and they only focus on the information that makes their point. And I think that's the thing that really bothered me the most about this whole BURZYNSKI thing, was the fact that there really wasn't any evidence that he ever said it was the cure to all cancers and he was going to save, he basically just said it's an alternative treatment that can help a lot of people, and in many cases has a higher rate of success than other types of treatments. And the fact that isn't an option for many people who are dying, I think people need to kind of look at it and say, why not? What is going on? What is, something obviously is there's something to the going on, and there's some corruption. There's some bigger corporation or influence or something that's not letting this become approved, because obviously they're like you said, the FDA, I think they said themselves that it was non-toxic, and that there wasn't. I believe that the side effects are minimum to in most cases. So there's no real reason not to approve it, and at least not have the option out there when the options that are currently out there, like chemo, radiation, are harmful, and really don't pinpoint any cancer. They just kill everything, they can, and many people die from it, from the radiation, and even if they don't die, they're going to have some long-term effects from it, even if they end up beating the cancer, and there's always a chance of it coming back. So I think that you're absolutely right with that, and I think that there is something about the idea of just saying it out loud. Hey, there's a guy in Texas that's doing this treatment that's curing cancer. People I think your first impression will be, there's no way. I think we try to find the good in people. We believe that if this treatment was out there, people would know about it. They would never restrict this guy from sharing his treatment. But unfortunately, that's not the case. And I think in one of your movies or interview, you talked about in '92 the signing of the FDUFA that basically let, for people who don't know, it was Bush signed this thing where basically the FDA could get money from pharmaceutical companies, which fees basically, yeah. And end up to think that anytime somebody's giving money to a organization or a politician, lobbyist or whatever, then of course there's always going to be a little bit of a favorism and a little bit of helping each other out. You scratch my back, I scratch yours, and that happens. And there's even been, I know in the past, I remember reading a story once about in 1969, FDA commissioner Herbie Lay Jr., who basically came out after he left the FDA, and he had an interview with the New York Times, and he basically came out and said what people think the FDA does and what it really does is as different at night and day, and the biggest issue is money. And I know that Dr. David Graham, the director of the FDA's Office of Drug Safety, said something similar, that the FDA was broken. So this isn't just some conspiracy theory of Dr. Burzynski, and he's the only one who notices the FDA is corrupt. I mean, there's plenty of cases of this, and there's plenty of, everybody knows about the big pharma revolving door of people working for corporations and working for the FDA and vice versa. And like you said, I think, isn't he basically the only cancer treatment that's patented by an individual also, that's not patented by a corporation?
Yeah, pretty much, as far as I know. Absolutely. Yeah. Sorry.
No, go ahead, Eric.
I was just going to say, it's an indisputable fact. It's nothing theoretical that the FDA has, the drug evaluation department, at least from what I know. I don't know as much about the food side as much as the drug side, but it has been purchased by the industry. They used their power, lobbying power in Congress, to devise the Drug User Fee Act in 1992. It was just another lovely, where corporations come in and they manipulate Congress to get a law passed that has, on the surface, it sounds great. Oh, we're going to give money to the FDA because they're supposedly short on funds to help push our drugs through faster. But in reality, now over 50% of their drug evaluation money comes from the industry. So there's the idea that it's a regulatory agency is sort of laughable, because all it is now when they've purchased it. So it's like, you have Pfizer and all the other guys on one end of the hallway, and then you have the FDA on the other. It's all basically one building now, So And if somebody like Burzynski wants to come in and get his drug approved, I mean, you can only imagine what kind of, they're probably just laughing behind the scenes, So yeah.
I believe he was in Suzanne Summers' book, Knockout, and the book that obviously you read about him. And he's not the only one. There's a lot of doctors. I don't know if you've ever heard of Dr. Gerson. Yeah, he's another one who German who basically talked about diet and all these and Suzanne Summers had breast cancer, and I believe used the alternative treatment and was cured by it, and then wrote the book called Knockout about the fact that there's all these alternative treatments that she felt like was unfair, that basically these options weren't out there for people, and nobody was the doctors weren't letting people know that, hey, you also have these other options and these other alternatives. So, and Chris Carr, who wrote the book Crazy Sexy Cancer, she and she did a documentary, another person who basically believes that nutrition, and she did a lot of spiritual things like yoga and stuff like that, and felt like just the whole wellness thing, and just there's other things that can help you become healthier and help you fight cancer than just taking these poison drugs and radiation that sometimes ends up killing you afterwards. So he's definitely not the only case, and definitely not the only alternative doctor out there. Unfortunately, it looks like he's definitely been harassed, and somebody is out to get him. It definitely seems like the FDA is now that he's obviously been fighting them. He's been raided. The money that and I think his lawyer in your first documentary, it was a pretty gripping statement when he's like, look at the money that the FDA has spent raiding this guy, bringing him to court numerous of times. You've had congressmen who come out and say, hey, it's obvious you're harassing this guy with no real reason to why you're harassing them. And many times in court, they don't even want to bring up the argument of if it's safe or not, because obviously they won't win that argument. So they just focus on trying to. I'm guessing I guess from your perspective, Eric, does it look like they're just trying to bankrupt them? Was that basically what they were trying to do?
Absolutely. I mean, that's just like anytime you want to take a guy out, and you have power within government, you'll file as many trumped up charges as you can on the federal level, which they did, as many trumped up charges as they could on the state level, which they did. He was audited numerous times by the IRS. I mean, they threw the kitchen sink at him. Yeah. I mean, so yeah. I mean, yeah. The reason that Burzynski, I mean, there are a lot of other alternative therapies out there, as you said. Start out with, there's no doctor has ever been trained in using diet and all that stuff so of course they're going to just snub their nose at it. What's so frightening about Burzynski to the industry is that this is a pharmaceutical grade proprietary substance that if somehow was magically approved, considering the patent's been around for a while, it would be exclusively owned by him for at least 7 years after it hits the market, and then of course it can become generic. And not to mention that he has second, third, fourth, and fifth generation technologies just sitting on the shelf. That's 10 times more effective than what he has now, what people are getting now. But he can't go any farther with that because he has to get the first one approved first, But anyway, I don't want to get too far off track, but yeah, I mean, that's really the biggest fear. I mean, there are a lot of other practitioners. One of the most little known ones, this guy named Dr. Burton. He also was sort of a more mainstream American doctor and chemist, I believe, and he had a form of immunotherapy, and he was driven out of the United States. Burzynski decided to stay. And this was also a proprietary substance as well, from what I understand. This was back in 1985. He moved his clinic to the Bahamas, and on the same day in 1985, the FDA raided Burzynski's clinic. Armed raid ban in 1985, and on the same exact day, the FDA made a deal with I guess you call the Bohemian government of the Bahamas, and they went in and raided Burton's clinic on the same day.
Wow.
Yeah, so it gives you an idea how far their tentacles go, and that was back in the 1980s. So Burton is still around. Well, he's not around himself, but the clinic is still around, and in fact, one of the patients from part 2, his coworker was cured of stomach cancer at this clinic. And when his fiance got brain cancer, he called the Burton clinic and they recommended Burzynski. Anyway, the point is, but Burton keeps very quiet. And in a way, in hindsight, maybe it's smarter that way. Because as soon as you become well-known and as soon as you become a threat, that's when the hammer really starts coming down. And back with Burzynski, he was on Sally Jessy Raphael in the 80s. He was on Oprah Winfrey before she was syndicated back in the 80s. He was getting a lot of media and a lot of press, especially in the 90s when the trial was happening. He was, with Tom Brokaw and every major nightly news, national broadcast all the time. And that, they do not want that. They cannot, because every time he's on the news, he just gets a whole pile of new patients flying in, and that's the last thing the industry can tolerate. You know what I mean? Because they want it under their control.
Yeah,
and it's simple. Yeah.
Yeah, I saw videos of him on CBS. I saw him. It was after I watched your movie, I went online and researched him, and it was I didn't realize how often he was on pretty mainstream TV, and which I thought was awesome, and obviously he's pretty public with his research. He's pretty public with what his techniques. Like you said, these skeptics definitely seem like they avoid the information that actually any information. It just seems like they're just trying to bash them, and that's kind of what they're trying to do. And it's kind of it sucks because even I was telling Dr. Burzynski, I mean, I could just imagine the criticism that he gets and the harassment you get, because just having him on the show and just sharing the fact that he's going to be on the show, I got people writing me on Twitter and Facebook and whatnot, saying that he's a fraud, or don't share bad treatments and this and that. And I'm just like, show me the information instead of just giving me your opinion. Show me the information. I'm more than willing to see where you're coming from, but just show me the information that his treatment is more harmful, or even harmful, but even show me that it's equally as harmful as the mainstream treatments, and show me that there hasn't been success rates. I mean, and that's the most important thing. I think it's no different, like you said, the war on drugs. I told Dr. Burzynski, it kind of his story reminded me of the whole thing with marijuana, like the fact that it obviously can help people. It doesn't have any real side effects, or it doesn't really harm anybody. It has all these benefits as medicine, but yet it's illegal. So why would people think that his treatment would be any different? It's all about, or most of the time, it's about how you profit, how you make money. I think Chris Rock had the joke that he said, "There's no money in a cure," and he's absolutely right. There isn't any money in a cure. There's money in giving somebody something they have to take for a long period of time. I told a story with Dr. Burzynski when he was on a little bit ago about Bayer in India. I don't know if you heard that story about which is which pretty insane. And these stories happen everywhere, and stuff like this happens. And so all it takes is a couple Google searches from noticing that the system is corrupt, and things like this do happen, and it's not an isolated situation. And the same people that are harassing other people or in bed together with other big pharma companies are the same ones harassing Dr. Burzynski, and they have the same intention. So it's not a isolated issue, and it seems like that's what people kind of lose focus on. People think that, why would they harass Dr. Burzynski? Well, if you don't believe his story, then look at a bunch of other stories. Look at how we're overprescribed with drugs. I believe soon we're going to have Dr. Gregory Smith from the movie American Addict on the show, and he perfect example. His movie's about painkillers, and just how often they just give them out like candy, and then how we're overprescribed, and the money that's in it, and so that the story is not just an isolated story. It happens, and it'll continue to happen until people get the research and the information and look at it with an open mind, and really don't just Google, Burzynski and read the first skeptic blog that you read, and really do your own research and look at it yourself. And I'm guessing you probably have gotten a decent amount of harassment, because doing 2 movies and stuff like that, I'm sure that people have jumped down your throats. I'm sure. No.
Sure, absolutely. Again, I'm going to respond to this in many levels. It's funny you mentioned the India thing with Bayer. That was Abby Martin that covered that on RT.
Yeah, I'm a big fan.
Yeah. So you look at one side of that, and you say, "Wow, these so-called skeptics are complaining that Burzynski charges too much money for his medicine." Yet, you're talking about a drug that they were charging over $100,000 to people in the U.S. when people in India can get it for $117. It's the same drug. So if that isn't enough for anyone to just shut up about overcharging, I mean. And secondly, you'll find this very interesting. I know Abby Martin, and she's tried very hard to get me and Burzynski on her show, especially after BBC did their hit piece, and after USA Today did their hit piece, and even RT, one of the highest levels in Russian government and the highest levels of Russian network were contacted. And
really?
they will not let the story air.
Really?
Even RT is being censored. Yeah.
And that's amazing, because I'm a big fan of RT, and because shows like Breaking the Set with Abby Martin and stuff, and I've actually tried to get her on the show too, but it seems like they're pretty, they basically give her, unless I'm guessing they're talking about Russia politics, when it comes down to the U.S. politics, they pretty much give her the green light to kind of, piss off Nesty or whoever. So it's pretty funny that even Dr. Burzynski will cross the line of censorship, so that's insane, because she really,
Sorry, I was going to say, Abby said it was the first time she had ever been censored by her boss.
That is crazy. That is crazy. Yeah, because she talks. I mean, I've seen plenty of interviews with her, and that one thing you always hear a lot about is, hey, you're on RT. How much how much restriction do you have on the stories? And she's like, honestly, I don't have any restrictions. She's like, it's sponsored by Russia, so obviously if she does a bunch of U.S. politic bashing, I'm not sure Russia's going to care too much. And so I'm actually really surprised that really Dr. Brzezinski was the only story that they thought that they have to draw the line and not share with, which is insane because I've thought that too. I'm like, I wonder if Dr. Brzezinski and Eric ever thought about being on Breaking the Set, because obviously she does a great job of hitting on similar stories of corruption and big pharma and stuff like that. So but like you said, the Bayer story, even though it wasn't directly about Dr. Brzezinski, it at least tells the story of corruption in because Bayer's drug was for, I believe, liver cancer or something like that. And like you said, it was $5,600 I read somewhere for a month's supply, and then they had it for a generic version for like $175 a month. And basically, Bayer was making sure that, or attempting to make sure that people couldn't get this generic version, which I think the India government rejected, which was good, and so that stuff does happen, and that's mind-boggling. I can't believe that Breaking the Set, which is a pretty, they hit on a lot of stories similar, and so that's awesome. Dave, you wanna?
You know what? I just had a great time talking with the doctor earlier and listening to Rick and the doctor speak. But the thing that I took away from him the most today wasn't the specifics of everything, but he actually said at one point, innovation in medicine is being punished, and to me, that's the real crime here. I mean, with everything that's happened to the doctor, to know that you had mentioned that he has second and third and fourth generation medication on the shelves just waiting. Like all this innovation and all this research that's being done, that's just being halted. To me, that's the huge crime here. Those were pretty much his words, that being innovative in medicine is being punished. And he actually compared it to Nazi Germany, how the doctors back then would flee and come to the United States, and he says it's basically backwards now, and that part of it blows my mind.
Yeah, no, you're exactly right. Like in my second film, Brzezinski Part 2, there's a guy named John James. He's a pharmaceutical chemist, and one of the reasons he agreed to be interviewed using the name of his company, Targacept at the time, was because he was going to quit, and because he got so sick of coming up with innovative, amazing stuff, only to have what he called the bean counter come in, at the end of every quarter, and pick only the things that have the longest patent life and the most profitability. And whether it worked or not, and regardless of its toxicity, was completely irrelevant. They did not give a damn about how well it worked or all they cared about was what the numbers said as profitability. And he couldn't take that anymore. And I'm not going to give you a whole long spiel about what he's doing now, but he's basically now traveling to different rainforests and things like that, and coming and getting all these substances that these people have been using for generations and bringing them back to the States. He's sort of he's giving funding and doing that. So here's a pharmaceutical guy, mainstream guy, that just couldn't take it anymore. Because what a waste of time. He was just basically a prostitute, Not why be a chemist and why be creative if you're not allowed to be anyway? So he's right. The market does not allow for that kind of jump in innovation. It will throw a big monkey wrench in everything. And you would think that if one pharmaceutical company had a monopoly on something like a great cure for cancer, it would be beneficial. But again, you have to remember that their patents are going to run out eventually on this, and it's not good financially. It's not good for the bottom line. And as you can see now, the economy and the corruption within the economy, especially with a widening income gap between rich and poor, is becoming even more ferocious than it's ever been. It's one of the most cutthroat environments than we've ever experienced, and it just keeps getting worse every day. So it's just a no-brainer. I mean, you can't interrupt that wonderful flow that's working fantastic for the upper portion, the stockholders, et cetera. And by throwing a monkey wrench in it, by throwing something as innovative as what Brzezinski's doing, it just doesn't fit within the program at all for them.
Oh yeah, and you see with you go to a doctor and they basically don't know anything about alternatives to the mainstream pharmaceutical drugs. I mean, they know Lipitor, but we have buddies who own vitamin stores and stuff like that, and they tons of great alternatives that could be at least a first resort, and then put them on a pharmaceutical drug as a last resort. But it never happens. Like, they basically have become. I think Bill Maher said once. He's like. Once you go to your doctor and ask for the drugs you want, then he's not your doctor anymore. He becomes your drug dealer, and you see it all the time. You know, I get magazines in the mail, and yeah, I still read and I still get magazines in 2014. But I get them, and you look in there, and there's like, rip this out and ask your doctor about this, and I'm just like, are you serious? Like, isn't the doctor supposed to tell me, what's good for me? Now I'm just going in there asking him, hey, can you give me this because I heard it was good? And the commercials don't really do a good job hiding it anyways, how harmful they are, because they usually have a list of side effects that are way worse than what they're trying to prevent in the first place. So it's just, anybody with, what I would call, common sense can look at this and say, hey, doctors are constantly prescribing these drugs. They really don't know anything outside of, these mainstream pharmaceutical drugs. And so if there was something out there that would get in the way of these profits for Pfizer and Bayer and whatever, then DuPont, whatever the companies are, then obviously they're gonna make sure they put a stop to it. And so it just you see it every day, and I think that it's a huge issue we have in America. I said this statistic and with Dr. Burzynski, how we're 5% of the world's population. Like, we take in like 50% of the world's pharmaceutical drugs, and it just, it's obviously that means there's a lot of profit, and when we're making that type of money, we want to put an end to it. So, like you said, it definitely pollutes the system, and hopefully we're doing like I told Dr. Burzynski, hopefully we do our part. Obviously, you've done your part with just spreading awareness with your movies, and that's awesome, because I think that it's the nice thing about documentaries is that it's a great way of getting a message across. It's if I just gave somebody something to read, then they might not be interested. But if I give them a documentary that tells these stories and it follows these people, and you see these people that should be dead and are alive. I mean, I remember what was it, that the youngest girl to ever the baby that Tori who did the anti-neoplastones. She's alive now at 14. I think she was in your movie, and there was there's pictures of her when they said she wasn't going to live, and now she's 14 in your movie, which is amazing, and to see stories like that, it just, I think for the average person, you can't see stories like that and say that it's fair that there's other people who could be alive right now who don't at least have the option. And that's what I keep kind of harping on, because I think that's the thing that bothers me the most, is that the option should be there, and the fact that you have to go through chemo first or radiation before you can even go to Dr. Burzynski, or however the routine goes. The fact that some people are restricted from at least having this option when really they have no other options. In your second movie, the story that what was it, Ben and Laura, who they were talking to their doctor, and they actually recorded the conversation, and the doctor was basically saying if they went to Dr. Burzynski once they came back to the UK, that he wasn't gonna look after her, and they're like, why not? And he was saying that he didn't believe in what he was doing or whatnot, and you could see her the parents and Ben, her husband, were like, I don't get it. Like, a doctor's job is to help people and then look after people, and just because you don't agree with what he's doing or don't understand it really, you're not gonna help this person live, and that was mind-boggling. That was a pretty intense story.
Yeah, that should be a perfect example. That's why I wanted to include that. I know it's really lengthy, but because I wanted people to understand this, because what I heard in that recording is almost verbatim of what the dozens of patients I've talked to have said. It's the same conversation, regardless of what country you're in or who your oncologist is. It's been that conversation with every single one of them. So, they're battling their disease, and of course they're arguing with their friends and family about making this decision, who may not believe in what they're doing to go to Burzynski. Then, of course, you've got your oncologist, who's he's a human being, but he's trained in a certain way, and he has to behave a certain way. And anything that isn't within his toolbox, he has to immediately say, no, I can't be part of that. So the Hippocratic Oath is irrelevant. It's sort of like, just sort of a mirage,
Yeah.
when it comes to this kind of thing. Yeah.
Well, we will.
It's pretty fun.
Yeah. Well, I know that you said you had about 20 minutes. I think we've had you for like 40. So I want to thank Eric for being with us. I think it's awesome that you're helping with the fight and put out awareness. I think that anybody agree with it, not agree with it, whatever, like watch these movies, and go to it with an open mind, and don't go in agreeing with one side or the other. Go in just with an open mind, look at the facts, and try to avoid the opinions, and definitely just watch them and make your own conclusion. And I think that people need to be more aware of these issues, and I think conversation is the first part of and documentaries are the first part of causing like a little ripple effect, and that's why this podcast is called the Ripple Effect, and that's what we try to do. We try to kind of spark thought-provoking conversations and expose some interesting people and stories, and hope that in our little way we're helping with the fight and helping with the journey. So any upcoming projects? I know you have a documentary called Second Option or Second Opinion that you're working on.
Yeah, I wish I could tell you. All I can tell you is I made an agreement with the party involved that we won't tell anybody what it's about until it's officially released.
Okay.
And I can tell you, though, very shortly, maybe even this month, but no later than March, it will be available. And it's yeah, I wish I could tell you more. I'm very, very excited about it.
And it's a documentary? It's a documentary?
It is a documentary. It's nothing like the Brzezinski film, but I will tell you it's in the same, sort of in the same genre, but it's nothing like Brzezinski film at all, or films. But I don't know, if you care about this subject, this one is sort of like the grand jewel to me. That's just me.
Yeah, well,
the
title of it kind of made me think about that too, because it was called Second Opinion, right?
Mm-hmm.
And that made me think like, it kind of made me think it was in that realm of getting a second opinion. So which is great, because I think that there's not enough movies hitting on these topics, and like I said, documentaries are a great way of getting this information out. You can be entertained and watch something that's thought provoking instead of watching reruns of Sex and the City.
Right.
So I just want to thank you so much, Eric, for being on. I think it's awesome that we got you and Brzezinski on the same day, and I think it's awesome what you're both doing. I think he's getting a lot of criticism and stuff like that, and his heart's in the right place, obviously, because he could just give up on this whole battle. He chooses not to, and I think you do the same. So you obviously probably knew that when you make two movies about something like this, that you're going to get some criticism, and it's going to be not an easy fight at times. But so I think it says something about who you guys are, because obviously you care more about doing what's morally right and than you do about trying to avoid conflict and criticism. So I think that's awesome.
Yeah, what? Also, last thing I'll say is when it comes to the criticism towards me and Brzezinski, there's not really that much criticism. It's just a handful of these, I'm sorry, but sociopaths that just live and breathe to pollute the internet with other, what they consider other information, which 99% of it is just pulling it out of thin air, or are, in the end, the most amazingly creative conspiracy theories you could ever come up with. These people are incredible. So, but when it comes to normal people that aren't sociopaths, that are able to think for themselves, that the average Joe, most people are open to this. They can totally get it. You'll find some weak-minded people that don't spend enough time with it, and they'll read some of the sociopathic bloggers, and then they'll just assume that they're right or whatever, and it'll sway them the other way. But it just comes with the territory. But honestly, I wasn't, as far as harassment goes, it's not really that bad. But you can't have a Wikipedia page without these guys destroying it.
Yeah.
It's just sort of the environment that we're in.
Well, you're right. I guess I assumed it was bad, because anytime I hashtag Brzezinski on Twitter, somebody will end up commenting on it. So it's funny, because like you said, a lot of times I'll go see who's this person that I've never heard of commenting and all of a sudden writing me all these messages, and it usually is somebody who works for some skeptic website or has some skeptic website, or some person who basically just goes around harassing people. If you look at all their posts, and I'm just like, this person, that's literally all they're doing. Like you said, it's not a reasonable person who's looked at the facts. It's a couple of loonies who are going around, who basically are making their life goal to just try to make ruin Brzezinski's name. And so I guess I just assumed, because the little that I've done of just sharing your documentaries, and anytime I'm hashtagging Burzynski or sharing your documentary on Facebook or Twitter, I've gotten some criticism. But you're right, it does seem like it's a small group of people who are just making their life goal just to kind of call him a fraud or whatnot and this and that. And I think if people look at the facts and people look at watch the movies, there's very little you can take from it that says that it shouldn't be an alternative, it shouldn't be an option, and it shouldn't be legal. And I know we watched like the BBC special on Dr. Burzynski. It seemed like that journalist also kind of went into it with already opinion. It didn't seem like he was right straight down the middle, which I'm okay with hearing both sides of the argument, but when somebody's already going in and their opinion is so one-sided that and you're considered a journalist or whatnot, and really at the end of the documentary, the BBC documentary, they really never said anything to prove that he was a fraud or he was doing something harmful to people or whatnot. So I mean, I'm not even sure why he seemed to dislike the clinic or whatnot. And also he said something about having a hard time to get Burzynski on the phone or whatnot. And I'm like, wait, BBC is getting a hold of Burzynski and he can't, and I can get him, and I have this little podcast show, and BBC can't get him. So I'm like, okay, that's BS. I'm like, I don't believe that one bit. So right off the bat, I kind of felt like he was already kind of pushing on to kind of sell one opinion. So, thanks, Eric. I really appreciate your time. Sorry that we went a little longer than expected,
it's okay.
But I guess when conversations flow, and why stop it? So
I'm gonna say two more things.
Go ahead.
The BBC is quite obviously, because all the patients from my part 2 were all in the UK, and more patients from the UK were asking about it. Again, it's the industry's job to say, okay, we're getting too much happening in the UK, pro Burzynski. Too many people are getting cured. We got to create a way to divert that attention, and that's all it was. Simple as that. And the USA Today thing was the same thing done here. And going back to Twitter, these so-called skeptics, each one of these skeptics has like 4 or 5 Twitter accounts. And that's why I included the skeptics section in part 2. They have what's called sock puppet accounts. And so they are basically trying their best to own Twitter. So you hashtag Burzynski or tweet anything about Burzynski, they will be on you within minutes. And they will even have conversations with you, one guy, as if there's 3 guys. So they'll sit there with 3 browsers open. And you know what I mean? It's really quite something. They're pretty clever for being dark lunatic sociopaths. They really have it figured out, But and I would say one thing about these guys, like, you look at, it's a really interesting study of the human condition, because the thing is it's hard for me to understand how someone can be such a sociopath. I guess that's why you have the term sociopath. Like, you have no ability to have, to be compassionate towards other human beings. And so you have to be such a dark lunatic to be able to sit around all day and harass cancer patients.
The other thing is that look at what they're fighting. They're basically trying to defraud or call somebody a fraud and possibly somebody who could get this treatment or would look into it in normal cases might be turned off by it because of what they're saying. So they in some cases they could be preventing people from really getting treatment that could save their lives. And like you said, if it was any other thing, if they wanted to talk about reptilians and other conspiracy theories, that's fine, because nobody takes that seriously. But you're talking about people's lives, and you're putting down a guy that is basically trying to save lives, and his whole life goal is to save lives and try to fight this disease that obviously we're not doing a very good job fighting already, because I don't know if we said this in this conversation or the other, but they said that cancer rates are going to rise 57%. So I mean, obviously, it just, is that a blender?
Yeah, sorry. Sorry.
It's okay. No, it's all right.
Rick's good at identifying background.
I'm good at, I'm really good at identifying what our guests are doing. We had one, Daniele Bagnelli, I think, was eating a steak. He didn't confirm it, but I'm pretty sure I heard him eating a steak while we were having a conversation.
No, it was my wife in the other room. Sorry. Yeah.
No, it's all right. No problem. But that's the cool thing about these things, is that they're unedited and unrehearsed. So that's life for you, unpredictable. So
absolutely.
But thanks again, Eric. Any closing thoughts? Well, I probably already.
Yeah, I think we had
A lot of
14 sets of closing thoughts, but that's how today has been. It's been really awesome.
It's awesome. I can't thank you guys enough. I think it's going to be awesome, the fact that we get to do our part, share some of this information. I know I've had a lot of friends of mine and a lot of people, fans of the show, who've asked questions about this show and really wanted to get, was looking forward to getting some more information. So I think the combination of having you and Burzynski, Dr. Burzynski on, I think that it's awesome, because I think we hit on so many topics, we hit on so many different points of views and stories that basically after listening to these two shows, people are gonna basically get a lot of information and really get to come up with their own opinions, and definitely go to BURZYNSKImovie.com. I'm guessing that's the best place to. I know you put the first movie on YouTube for free, and then the second one you can get on most places that you can get on demand, like Amazon and stuff like that. So that's the best way, right, of doing that.
And part 2 is also, they're both actually on Hulu now.
Okay.
If you have Hulu, I mean, I don't think you have to have Hulu Plus. You can still watch it. You just have to deal with the commercials.
Yeah,
but yeah, the DVD on demand is available anywhere you want to get it. So.
Awesome, Eric. Hey, I just want to thank you so much for being with us. It was an awesome conversation. I think that anybody who watches your movie realizes why you're so passionate about this, and I think anybody who watches your movie will probably equally be just as passionate about this issue. So I just want to thank you again. Hopefully we didn't get you up too early, because I know you're LA time, so we didn't make you wake up too early on a Friday. But thanks again, and keep in touch. Hopefully we'll have you on in the future for once your other documentaries, your other work come out. Maybe we'll have you on and talk about that stuff.
Sounds good.
Thanks, Eric. Hey, enjoy the rest of your day.
Thanks, you too.
Thank you. Bye.
Believe in the ripple effect.